Well, hello. My name is Carolyn Katzin, and I'm listening to all this about the immune system. And as you can probably hear, I have a little bit of a cold, and the great news is that immune therapy and immune system that is internal to us will get rid of that. And so our immune system is so powerful. What we're learning, of course, is how to harness it. And with this wonderful sarcoma program here at UCLA, you're in good hands for how to do that. I'm going to switch gears a little bit and talk about nutrition and integrative oncology. So integrative is kind of a buzzword now, where we used to think about complementary and alternative medicine, and the National Institutes of Health had a department called CAM. It has now been renamed integrative therapy. So integrative literally means we're pulling everything together. And my role at the Simmsman Center for here at UCLA for integrative oncology, what we're doing is we're offering psychosocial support and how the mind, the body, and the spirit, when they're in balance, which of course is a dynamic state, that is a state of health. And part of what we're doing is helping you individually work with your specific type of cancer. And every single cancer is different. Every body is different. We're all unique. So how do we work with our own bodies, our own systems, to improve quality of life and make your life more pleasant? So we have a whole wide variety of different modalities. Mindfulness and meditation is something else that's offered at UCLA, and we offer some tools for that. There's an app for that too. There's an app for everything. And wellness and physical activity. Part of why physical activity is important to the limit you can do it is because when we're active, we're also breathing more deeply. And when you breathe more deeply, you're able to normalize pH and do a lot of other things that people think can only be done with diet. Qigong is a wonderful way of gentle movement. We have Qigong classes in the gardens here every Wednesday morning. Spiritual health, we have a chaplain doing a non-denominational spiritual support, and music therapy. I had a patient who has quite a nasty diagnosis, and we were talking about finding his note, and he's now going back to a choral class that he used to be. So there's all different ways that we can balance our health. So a lot of times people come and say, what can I do? And one of the few things you can do is actually related to diet. And so I have a lot of material to get through, and I apologize if I go too fast, but if you want to learn more about what I'm offering, of course, come and see me. But also our Simmsman Center has a website, and I have had several talks that are 90-minute long, probably more than you want to hear, on the videos, our Insights lecture series, and a couple of weeks ago I did one on strategic nutrition that is more in depth, so you're very welcome to go there. I think one of the lessons we learned from HIV-positive patients who've lived long, 30-plus years now, is the value of glutathione, which is a protein that's part of many enzymes in the liver and the kidney. And that was where we learned that whey, or whey protein, which is a part of a dairy products, it has a peptide, gamma-glutamylcysteine, which is actually a support for glutathione, which is why some people have been taking whey for that amount of time. So what I've put together is a concept of 3 key components, which is maintaining hydration status. Hydration, of course, is important for many, many different processes in the body. Getting sufficient protein and making sure that the fuel that you take in is appropriate. And I also want to touch a little bit on the microbiome, because just as integrative is a buzzword, the microbiome is another one. Just a show of hands, how many of you have heard that term or know what it is? Okay, about 4 only, so okay. You will be hearing a lot more about it. And I'll talk a bit in a moment about it. It is essentially the microbes or the organisms that are beneficial, that live in and on us. And of course, those that live in us, we have approximately 10 times more microbial cells than our own cells. And the digestive tract is where they are mostly located, not completely. So if we look at nutrition during treatment, this would be whether it was chemotherapy or radiation or immunotherapy or molecular targeted. We want to get enough protein and also to stay well hydrated. And these are just some ideas for how to do that. Hydration is very, very important, as I mentioned before. And a simple way to know if you're hydrated is actually to look at the color of your urine. If it's very dark, then it may be that you're not getting enough fluids. And it's important to have fluids throughout the day, but often people say, well, I have to get up and down all night. Then I say, just make sure when you get up in the morning, have a large glass of water or hot water with lemon, and then just keep going through the day. But the morning is especially important. Ways to add extra protein, well, one way would be with whey, to use it. But there are other unflavored protein powders that you can add to soups, for example, or even mix into cottage cheese or any other dish. One of the things that people talk about, and there's certain truth and certain not truth, is they say sugar feeds cancer. Well, it's a kind of a complicated topic. However, as you can see from this graph down the bottom right here, the consumption of sugar has really gone up significantly over the last 100 years. And the last 30 or 40 years, we have been consuming a huge amount of specific types of sweeteners, especially those high in fructose. And that is, of course, causing an obesity epidemic. What's important, though, is not so much the type of sugars as the way we're consuming them. So, for example, if somebody's having a large beverage with no fiber and no other context, that sugar releases insulin, which also releases, upregulates a gene called IGF-1, which may exacerbate tumor growth. So it isn't that the sugar's feeding the cancer so much as the insulin-like response. So adding fiber blunts that insulin response. And what we see here is, for example, something which is called a high GI or glycemic load. We usually are talking, I'm sorry, let me go back there. Glycemic load is the combination of foods, but an individual food would have glycemic index. Gly means sugar, emic is blood. And if you add fiber, what you do is you're reducing it down from the high to the low glycemic index. I don't know why that didn't come out. Oh. Well, anyway, I'm sorry about that. I don't know why this didn't come out, but it was essentially a diagram where the microbiome is in the middle, or the microbiota. And the reason for that is because of the fundamental importance of the microbiome to our health. So cancer-fighting foods, it's important to have a variety of different colorful vegetables in particular, and spices. I noticed a book outside talking about turmeric and curcumin and spices. And we know that many parts of the world, people have a lot of spices with every dish. And this is very, very helpful. The colors are maybe showing us that they have more of these, what are called bioactives. And the bioactives are literally active within us. Over the years, I've put together a concept to sort of simplify things as much as I can, maybe just for myself and hopefully for you too, is what I call the 3 A's of DNA integrity. So antioxidants are important for protecting DNA from damage, such as from radiation, which is sometimes natural radiation or sometimes intentional. Anti-inflammatories, which of course we've heard a lot more about inflammation. And oxidation and inflammation are part of a natural immune response. And then the anticarcinogens are the idea of how to prevent consistent damage that then persists and causes cancer. So these bioactives, this is just a sort of overview of some of the many different compounds that are found. The late John Milner from the National Cancer Institute used to say that we were exposed to some 23,000 bioactives every day, whether we're eating them or drinking them or breathing them. And many of them are because plants need their own defenses. They can't run away from harm, and they produce their own. Many have antioxidant activities, and some of them are of benefit to humans. So when would you need more antioxidant-rich foods? Well, obviously, if you're having CAT scans or X-rays, it would be smart to have those foods. However, we do know that the supplements are not recommended. And this is kind of paradoxical. It's like, well, why wouldn't we want to have these supplements? What's happened is that many studies have shown that actually supplementing with beta-carotene, vitamin E as alpha-tocopherol, or other single dietary supplements have actually had adverse outcomes, higher mortality, and so we don't recommend that. Inflammation, we've been talking about a little bit in terms of how to minimize chronic inflammation. And here you can see that in a situation where there's a chronic inflammation with a lot of release of pro-inflammatory mediators, there is a higher risk of different types of cancers. So would you choose to have more anti-inflammatories if you have chronic viral conditions, anything that ends itis, such as an autoimmune condition? And these are some examples of some foods that are rich in natural anti-inflammatories. And these would be things such as oily fish, some of the seed oils, natural aspirin-like substances. And this is where curcumin would come in. Turmeric is curcumin is the active ingredient, the main active ingredient in turmeric. And many of the culinary spices and herbs that have been used over the decades. During treatment, we usually recommend that people would take anti-inflammatory rich foods often, and they may or may not take some supplements of omega-3, such as DHA from microalgae. Now, when you see products in the market that say fortified with omega-3, if they tasted of fish, you wouldn't be having them. It's because it comes from algae, so it doesn't have the fishy taste. You might want to cook with some of the spices. But of course, part of what integrative means is that we integrate everything together. And it may be that if a patient is already on a blood thinner, then taking a lot of omega-3s and having a lot of salicylate-rich foods might not be recommended. Or at least if it was going to be done, then we'd want to document that in the electronic record so it could be actually reviewed. Anticarcinogens are basically, of course, everyone here in this room is interested in that. How can you prevent further damage? How can you maintain a state of health? And the main thing to remember is that when many pathways, even there are driver mutations, that we have other workarounds. Our bodies are very, very sophisticated, different machineries in order for us to have survived for so many millennia. And so some of these foods we've perhaps been eating, but not regularly. So I often recommend to have 1 or 2 of the vegetables from the garlic family and 1 or 2 from the vegetables from the cabbage family or the broccoli family on a daily basis. And you can do that by making soups. You can do that just by having vegetables, but those are really going to be supportive. And then possibly adding in things like curcumin or some citrus. And I want to just put a plug in here that many of the newer molecularly targeted therapies pass through an enzyme that is actually affected by grapefruits. So you don't want to be having grapefruit or grapefruit juice if you're on any of those, or at least check with your healthcare provider. And again, these would be the anticarcinogens such as broccoli or garlic. Another anticarcinogen, or something that is of great interest to many people, is vitamin D. And vitamin D is really not a vitamin, it's really a hormone, meaning it's made in one part of the body and active in another. And it's also being associated with the different risks of different types of conditions, and some of them are immune conditions. A very recent study showing that respiratory tract infections may be minimized in patients who have very low vitamin D levels if they take a supplement. Some people just have naturally very low levels. So one of the increasing blood tests that people are asking for now is a vitamin D, serum vitamin D, and find out if you just happen to be one of those people. This is another way of looking at digestion or digestive health. I get a lot of confusion about people who think enzymes are probiotics. So probiotics fit into that category of the microbiome. So probiotics are kind of like the opposite of an antibiotic. A probiotic means for life, literally. So these are things that provide support for our healthy microbiome, or the microbes that live, the ecosystem that is within our colon. And there are fibers that are particularly beneficial for the probiotics. And those fibers are sometimes called prebiotics. And in the future, you will be seeing a lot written about what is now being even called a whole field of pharmabiotics. And pharmabiotics is how we are learning by changing the prebiotic or dietary fibers and some of the probiotics, you can actually get some very significant clinical outcomes. But this is all very new, and it will intersect with immune therapies, and it will integrate with everything. However, just going to the market and buying a probiotic over the counter is probably not going to be doing what you want. It is a field that is emerging, and if you are looking to take a supplement, I would encourage you to talk to somebody who's familiar about it, not the clerk in the health food store. For many people, we know what we should be doing, we know what we want to be doing, but perhaps there are some barriers as to why we're not doing that. I know for myself, if I'm not feeling well, I might not be picking the healthiest foods. So these are some of the barriers that when we're working one-on-one, I would work to try to help you understand those barriers and to work around them. As I mentioned before, there are some foods that have particular benefits. They have benefits in terms of supporting the microbiome. They have benefits in terms of supporting healthy liver and kidney function. They have benefits in terms of perhaps reversing dysplasias or changes that are precancerous. And there are a number of different foods here that have some particular benefit. And one of the reasons to be choosing these types of foods is that it gives you a sense of control, and it gives you a sense that you're doing something positive for yourself. And that's different than going out and spending a fortune on lots of dietary supplements. This is actually food-based, and we'd be getting the quantities that would be in nature, but you're customizing it and focusing it so that it's providing more nutrition for you, and that should help you feel less that you're in a field where you're not doing anything. So in summary, and I do apologize for going so fast, but I want to be sure that Sandra has time because I know she has a lot to say too. And as I say, there is a lengthy lecture that is on our website through the Insights video where I do go into a lot more detail about everything here. But the idea is to eat smart that's right for you. And we're each of us very individual. Each of us has very individual types of mutations that cause this particular disease. And for each person, it's important to focus on that. There's no one right diet for everybody. I also think it's important to remember that food is one of our greatest pleasures. And joining with loved ones and eating a relaxed meal, I mean, there's nothing, very, very few things that are as pleasant as that. So we shouldn't think about food in terms of just numbers. Food is really for pleasure. Organic produce, it makes sense for some things like apples and strawberries. It's smart to buy them organic because they tend to have a higher pesticide load, and you don't want to be adding additional loads to your body than you need to. Being active is important because of the breathing. Because when you're breathing well, you're not only doing something that makes you feel better, but it's also helping your whole body. And as I said before, this is a dynamic state of health. It's not something you don't achieve a state of health and that's it. It's every day we're doing something. And sometimes it means that you're feeding more of your body. Sometimes we're focusing more on the spiritual side. Sometimes we're focusing more on the mental side. But it's sometimes just having that quiet time to think and to calm down, to allow yourself to say, what do I need today? What's important for me today? And love, I think, is the most important thing. This is actually something that Dr. Milner used to show at the end of his slides. And in honor of all that he's done for me, I like to show this one too. And I think we have some time for a couple of questions, but then, as I say, I don't want to take time away from Sandra too, and I know then we're just between you and lunch. So, yes, in the back.
Yes, I have a question in regards to vegetables.
Yes.
I've read a lot about eating raw
Okay.
instead of cooking, that you lose a lot of the benefits of the...
Right, right. Okay, so the question is about vegetables, and do we lose a lot of benefit if we don't eat them raw? And that's a great question, because it really depends. The moment a vegetable, particularly the cabbage family vegetables, the moment those cells get broken open, they release a substance that is beneficial to our bodies. However, if it's released prior to consumption, it kind of loses its value. So that's kind of a problem, because people are trying to create supplements that would be the released product, and that isn't the same. Vitamin C is definitely temperature sensitive and air sensitive. So if you juice oranges, for example, you leave it out in the room, it's going to lose its vitamin C content. But in general, the types of benefits or bioactives that we're looking for are actually relatively heat stable. And there was a large food intake survey done in Europe where they were looking at the benefits of different vegetables. And in particular, they're looking at tomatoes. And actually, I think it was looking at prostate cancer risk. And they found that cooked tomatoes were of benefit, whereas the raw ones were not. Now, nobody was completely sure whether it was the tomatoes or the fact that if you had cooked tomatoes, you probably had them with oregano and thyme and all the other culinary herbs. So we don't really know. Unfortunately, nutrition is it's kind of a very broad and somewhat soft science. Nutritional science, which is what I specialize in, is much more focused. But in general, I think eating vegetables are beneficial. That's the main thing. And you do want to keep the fiber in there as much as possible, because the fiber is providing the probiotics with the prebiotics, which is the benefits. So now everyone knows about the microbiome, right? You know about the prebiotics and the probiotics. And I think going forward, you'll find that that will be a topic where a lot of people are talking. So now I want to introduce Sandra, and thank you.